Qatar offers modern medical care through a system of public and private healthcare providers that are comparable to some of the best healthcare systems in the world. Residents have access to 7 main hospitals, plus more than a dozen private health centers and clinics in Doha alone. Dependents receive medical care through a network of civilian providers in Doha, managed by TRICARE Overseas Prime Remote. We encourage you to check out the program's provisions at their website, www.tricare-overseas.com/TPR.htm. TRICARE will primarily utilize private healthcare facilities for routine, non-emergent medical care, as waiting times are short and doctors and nursing staffs are well-trained and responsive. Dependents seeking routine, non-emergent medical care will first contact TRICARE via phone or email to explain their medical concern. TRICARE then works behind the scenes to find the appropriate provider in Doha and relays that information back to the dependents to schedule an appointment, a process that could take hours or several days depending on the level of care required. However, there should be no out-of-pocket expenses to you, as TRICARE will arrange direct payment to the healthcare provider.
We have gone to the emergency room late at night where we haven't had time to do that, and the emergency room was empty. There was a doctor who came to see our daughter right away. There was a nurse that was available to see her right away and take all of her vitals. We didn't have to worry about anything. I think we left our home at 3 a.m. and we were home by 4:30 a.m.
One of the unique aspects of using TRICARE in Doha is that dependents are not assigned a local primary care manager. Rather, the TRICARE staff in the Eurasia Africa office will serve as the dependent's primary care manager to ensure continuity of care. This means you may not be seen by the same local provider each and every time. However, TRICARE will work to ensure your medical needs are met.
The medical system here is sufficient. There are certain procedures that you'd probably prefer to have done back in the States. But as far as routine medical care is concerned, we found that this place has been very satisfactory.
The primary purpose of the 379th Expeditionary Medical Group is to support active duty service members. It is not part of the TRICARE healthcare network. At this time, it does not enroll dependents or retirees and is not staffed with pediatric or women's health specialists. Prescription pharmaceuticals that are not available through the Qatari medical system or the 379th EMDG can be ordered through the TRICARE mail order express script system. Dependent dental care can be acquired through the Qatari dental system via the TRICARE dental program, just like you would in CONUS. Optometry services are also available much like they are in CONUS. As previously mentioned, military members assigned to Al Udeid receive on-base medical and dental treatment from the 379th Expeditionary Medical Group. Services include immunizations, optometry, physical therapy, mental health, emergency and primary care, pharmacy, radiology, and laboratory services. Although there are excellent healthcare providers in Qatar, we cannot guarantee command sponsorship to members enrolled in the Exceptional Family Member Program. If your dependents have certain medical conditions that require specialized treatment or continuity of care, you should discuss the situation with your current medical treatment facility prior to applying for command sponsorship. You should also understand that it will take several weeks to medically screen dependents. If you are approved for command sponsorship, you should act immediately to start the dependent clearance process. If dependents are not medically approved at least 90 days prior to report no later than date, concurrent travel of dependents is not guaranteed.